right, so I am going to check my order, gather my supplies. I'm at the MAR now, so I'm going to double check that I have the correct patient. Also that I have their correct medications that we are giving them. So today I'm pulling Humulin N, the NPH. I'm pulling 15 units of that. Humulin R, 13 units, and ceftriaxone, 750 milligrams. I'm also going to make sure that I have no allergies on the MAR and any contraindications for any of the medications. So I've gathered everything up and I'm going to wash my hands. And here we go. Hi there, Mr. Smith. I'm Lindsay. I'm going to be your nurse today. How are you? Good, good. All right. So first thing, if I could get your first and last name and date of birth. Perfect. And we're going to go ahead and scan your armband here. And I'm going to scan all my medications as well when I give them to him as well. So we can go ahead and we can scan the ceftriaxone and both of our insulins. So, Mr. Smith, I am giving you your insulin today for your diabetes. It looks like our blood sugar is 180, so we are good to take that. Also, your ceftriaxone, I'm giving you that for the infection from the dog bite. And is there a preference on which one you'd rather have first? Perfect, we can do insulin. So, I'm gonna grab everything that I need here. And I'm gonna clean my vials off at the top here. Also for the NPH, I'm going to want to mix that up. I don't want to shake it though. I'm going to just roll it between my hands. So we're going to start by inserting 15 units of air into our NPH. So I've got my 30 unit syringe here. So 15 units of air in, 13 for the regular. So air in, and then we're going to pull 13 units here. And so kind of hard to see, but there is my 13 units. And I'm now going to go and pull my remaining 15. So I'm going to have a total of 28 units total. Okay. So there's my 28, and insulin is a high alert drug, so we do need to make sure that we're having another nurse come and double check it before we give it. So this is going to go in our sub-Q. So I'm going to do Mr. Smith's abdomen. So that's going to be 2 inches away from the umbilicus and any other scars, anything, wounds of that sort. You can also do it on the back of the arm or also the thigh, but you're going to pinch an inch here. Whoop. Sorry, shot out from practicing. So pinch an inch and straight in. So we can't go straight in since he is an average sized person. Pull that out. So we're not going to want to massage that. You're going to also engage your safety and discard accordingly to your institution. But we don't want to rub this because we don't want to cause a hematoma. Mr. Smith, you could have some signs of some tenderness, and if that's okay, just don't massage it. But then also some signs of hypoglycemia with this. So the next thing we're going to give you is your ceftriaxone. So we've got our dose here. Again, I'm going to clean my vial. Perfect. And then clean the skin and let that dry. And next, so I have my 23 gauge 3 milliliter syringe here. I'm going to attach my blunt tip, and we are doing 750 milligrams, which is equivalent to 0.5 milliliters. So I need to put the 0.5 of air into the medication. And then I'm going to pull that up. I am going to make sure that I also have the tip of the needle in the fluid when I'm pulling. Okay. And we're going to cap this. So there is my 0.5. I'm going to attach my needle. And then this one we're going to give in your deltoid. We're gonna look for the acromion process and go about 2 fingers below that. So if we're be right about there, we're gonna go straight in like a dart, 90 degrees. There we are. And Mr. Smith, with this, you could experience some GI upset. So we're talking nausea, vomiting, diarrhea, something of that sort. Do you have any questions right now? Perfect. So we have your call light all set for you. I'll be back to check on you in 15-20 minutes. And if there's not anything I can do for you right now, then we are all set.